Okay, we're going to go over the changes in laws and in legislation in the last couple of years when it comes to your insurance, and we're going to start by going over the Deficit Reduction Act of 2005. Oh boy, right? Well, this presentation is going to cover Medicaid asset transfer and partnership portions of the law. So let's get started here. Okay, President Bush back in February 8th, 2006 said at the bill signing, without reforms to entitlement programs, spending for Medicare, Medicaid, and Social Security alone will be almost 60% of the entire federal budget by 2030. That will leave future generations with impossible choices, staggering tax increases, immense deficits, or deep cuts in every category of spending. So what is the Deficit Reduction Act? Well, the Deficit Reduction Act made Medicaid planning very difficult by closing most loopholes that have been used in the past. It allows states to begin new long-term care insurance partnership plans to give residents an incentive to purchase a protection plan. Effective date is the date of enactment, so which would be February 8, 2006, unless state legislation is required, and each state is individual too. We will touch on that. So first major part of the 2005 Deficit Reduction Act is the transfer changes will have the largest impact on Medicaid planning. So a look back period for gifting money or gifting a transfer asset used to be 36 months, now it's 60 months. So they do a 5-year look back period now. There's also a penalty period now, begins on the date of eligibility for Medicaid instead of the date of the transfer was made. That is huge, and a lot of people don't understand that. So let's go over an example. So my example is John and Mary here. March 1st, 2006, they transferred $200,000 to their child. Let's just make it a single child for the example to make it easy, and we don't have to deal with brothers and sisters. But so they made a transfer of assets, $200,000. April 1st, 2009, John goes into a nursing home now. He is eligible for Medicaid immediately because he meets the guidelines for a Medicaid spend now. So let's look at the example here. So here's the look back period. You know, the old law was 3 years, the new law is 6 months. So here, let me bring my cursor in here. So as you can see, under the old law, the 3 years, so he made a transfer in 06, not a problem. 3 years goes by, he's home free. He can be on Medicaid. Well, under the new law, it's 5 years now. So he made the transfer. Well, look, the 5 years, that transfer was made within 5 years. So he's going to incur a penalty now. So what is that penalty? Well, this is how Medicaid figures out the penalty, calculating the penalty. The penalty is you divide the amount of the transfer by the average cost of the statewide nursing care facility. So the average cost now, so in this example, the average cost came to $3,888 a month. So we take the transfer of $200,000 back in March 2006, we take $200,000, divide it by the average now, $3,888, that gives us 51.44 months. So under the old law, this would normally be rounded down. So beginning date of eligibility now, that was the second part of this. So under the old law, the penalty applied from the date of the transfer. Well, under the new law, the penalty applies at the date of eligibility. So can you see the problem here? Under the old law, he was eligible April 1st, 2009. So they're going to say, well, 51 months. So we go back 50, we go back to when the transfer is made, 51 months. Okay, so he has 14 months of paying a penalty left. 14 months. Well, under the new law, the penalty starts right when he was eligible. So if he is poor, broke, goes on Medicaid, goes into the nursing home, and he says, I need assistance, they're going to say, you have a 51-month penalty, buddy. You got to come up with that money, because you transferred that. Well, I hope the kid didn't go out and spend that $200,000. So here's what's going to happen. So when John becomes eligible as of April 1st, 2009, the family will have to pay the 51 months of care before Medicaid will kick in. So remember, the penalty could cost more than what was transferred. So under this example, let's say his actual nursing home care cost is $4,350 a month, which is more than the average. Well, he's got to pay 51 months now, which will cost him $221,850. And the family has to come up with that. Either the spouse now or the child. That's where we get into FILIA laws. We'll talk about FILIA laws later. Let's also talk about home equity limits. So under the old law, the value of the home is not used to determine eligibility for Medicaid. Under the new law, individuals with more than $500,000 home equity are ineligible for Medicaid. This doesn't apply if a spouse, minor, or disabled child lives in the house, though. Expectations in the case of hardship. So this applies for all Medicaid applications filed on or after January 1st, 2006. So the laws are changing. So there's also treatment of annuities and how they have changed. Under the old law, the loopholes were included. Medicaid annuities were bypassed, probate, no problem, right? Lickety split. Under the new law, requires Medicaid applicants. Annuities must meet conditions or could be penalized. The state must be named as remainder beneficiary for the amount paid. Think about that. So the state is a beneficiary under your annuity and you didn't even know it. It's in the fine print. Portions of the community spouse, minor, or disabled child also would be on that annuity as well. Alright, so purchase of life estates. A lot of people used to do purchase of life estates, and the old law, they used to be fairly open. Under the new law, they can also be penalized for the purchase of a life estate interest in another individual's home. That is, unless the purchaser resides in the home for a period of at least 1 year of the purchase of the date. So there's also a couple other loopholes here. The other loopholes require state-imposed partial months of ineligibility. Multiple transfers will be all accumulated into one penalty period. So let's say you give a gift every year to your kids. Well, we're going to accumulate it as one big gift. There's the income first rule, and that goes into effect like when you have a spouse that's in a nursing home and the other one is not, and they're both getting Social Security. They have the income first rule test there. Certain notes and loans and admissions contracts. Okay, so a Deficit Reduction Act gave us a big, huge advantage though with all these laws. States are passing partnership programs. So we're going to talk about partnership programs here. They regard into long-term care insurance, different kinds of health insurance, which we will review here.